Welcome everyone to today's presentation on thoracic spine and thoracic cage arthritis. We'll dive into the radiographic findings, clinical presentations, and key distinguishing features of various arthritic conditions affecting this region of the body. Get ready to expand your differential diagnosis skills. To kick things off, let's review the minimum radiographic study needed to evaluate the thoracic spine. At the bare minimum, we should obtain AP and lateral views of the thoracic spine. However, it's often helpful to get additional projections like swimmers and PA chest views to better evaluate the articulations of the ribs and spine. Don't forget, whenever you have thoracic spine images, take a moment to carefully examine the soft tissues of the mediastinum and lung fields that are included on those views. You may pick up additional important findings. Now let's look at a case, a 43-year-old female presenting with mid-back pain. On the imaging, we can appreciate classic features of osteoarthritis affecting multiple articulations in the thoracic region. Osteoarthritis can impact the discovertebral joints, where we may see disc narrowing and osteophyte formation. Don't forget, the proper terminology for discovertebral degeneration is degenerative disc disease, spondylosis, or intervertebral osteochondrosis. The facet joints can also be involved, as well as the costotransverse and costovertebral joints between the ribs and vertebrae. Osteoarthritis at these rib articulations is specifically termed costotransverse arthrosis and costovertebral arthrosis respectively. These can clinically mimic upper GI pathology with referred pain. Looking more closely at the radiographic features of osteoarthritis in this region, disc narrowing is common, though keep in mind the upper thoracic discs from T2-T4 are normally quite narrow. We may see small osteophytes forming, which interestingly tend to be more prominent on the right side. This right-sided predilection is thought to be due to increased microtrauma from the aorta pulsating against the right side of the vertebral bodies. Other features can include end-plate sclerosis, intercalary bone formation between the vertebral bodies, and sometimes vacuum clefts within the discs. Transitioning now to our next case, a 50-year-old male with fatigue, chest wall pain, and a rash. The imaging findings demonstrate features consistent with dermatomyositis or polymyositis. Dermatomyositis is an autoimmune condition that attacks the muscles and skin. It typically starts in the proximal lower extremities before progressing to the upper extremities and neck muscles. Patients can develop an associated non-erosive, transient arthritis. There may also be pulmonary manifestations related to the underlying autoimmune process. From a radiologic standpoint, we can see several key findings with dermatomyositis. Early on, there is soft tissue inflammation with increased thickness, increased density, and blurring of the normal fascial planes around the muscles. As the disease progresses, sheet-like soft tissue calcifications may develop within the inflamed muscles. In later stages, we can see soft tissue atrophy from chronic muscle injury. Steroid treatment puts these patients at risk for complications like osteopenia and even osteonecrosis. Around the joints, we may appreciate periarticular osteopenia, swelling, but typically no erosions given the non-erosive nature of the arthritis. While we covered some of the more common arthritic conditions in the thoracic region, there are several other disorders we should keep on our radar. Degenerative processes like degenerative disc calcification, ossification of the posterior longitudinal ligament, neuropathic osteoarthropathy, and diffuse idiopathic skeletal hyperostosis or DISH. Inflammatory conditions such as the spondyloarthropathies like ankylosing spondylitis, psoriatic arthritis, reactive arthritis, progressive systemic sclerosis, and rheumatoid arthritis involvement. Finally, crystal deposition diseases like calcium pyrophosphate dihydrate deposition disease and the rare condition alkaptonuria.